approximately 1 hour. If we run out of time and you still have questions, we will continue on for Susan. She was part of the first graduating class from the Kenmore campus. She also completed the residency program at Bastyr Center for Natural Health in Wallingford, and then returned to her native California to practice naturopathic medicine. She has been invited as a guest lecturer at Cal State Fresno and Cal State Stanislaus. She has also taught special cooking classes at Whole Foods and cooked professionally in Napa, California. Her passion lies in helping people become aware of how to attain a satisfying quality of life through health and joy. Okay. And Dr. Cartwright, I will now turn the presentation over to you.
Good afternoon, everyone. I'm presently here in Sacramento, California, and luckily for me, the sun is shining and it's a beautiful day today. So we're going to start with, does everyone see the first screen with my picture on it?
Yep, it looks good.
Okay, so I will start now. So, my background, being from California and wanting to eventually practice in California, I decided to do my pre-med studies here, and thus I graduated from University of California, Irvine. When I discovered naturopathic medicine, I chose Bastyr for its research opportunity, and I worked at the Research Institute for 5 years. I have my own private practice, but I'm also part of an amazing mental wellness group called Health Psychology Sacramento. This group has psychotherapists, yoga instructors, massage therapists, music therapists, and me, the naturopathic doctor, for biomedical and nutritional therapy. We treat depression, ADHD, autism, bipolar disorder, and addiction. It is insurance covered, and so if you want to learn more about it, you can go online at healthpsychologysacramento.com for more information. And I also do have a private practice in Sacramento where I see patients separately. Why did I choose naturopathic medicine? Well, I wanted to practice medicine that teaches people how to be healthier. Some of you might be familiar with that saying, you give a man a fish and he eats for just 1 day. You teach a man to fish and he can eat for a lifetime. Well, the same thing with health. You can give a man a pill and he might feel better for a day, but if you teach a person about good health, that person can be healthy for a lifetime. People who are emotionally supported have better health outcomes. The UW cardiology study showed that patients with positive outlook had shorter recovery time and better long-term outcomes after heart surgery. I also want to offer long-term solutions for health. I want to offer a wider range of safe and effective medicine to my patients. And I chose to focus on mental wellness because I discovered that emotional health is strongly correlated to physical health. And many people suffering from chronic physical illness also suffer from anxiety, depression, and stress, which can hinder their health outcomes. So my weekly routine. I research every single case that I have because every person is unique, and I try to find the root cause for their health issue. I look online for latest clinical research on therapeutics. It's important to see what treatment options are being looked at, both conventionally and alternatively, because it gives you some clues to what fundamental biological process is involved. For example, there's evidence of depression being linked to gut inflammation that came out a few years ago. So if I have a depression case, I make sure to rule out inflammation as one of the root causes. You can have 5 different depression patients and have 5 different reasons for them having depression. So to successfully treat a patient, you must find their specific root cause. Being a doctor and listening to people's difficulties and caring for others is a big energy-draining activity. So I choose to practice part-time for my adrenal health and for also my family. I make time to do things that I enjoy, and that is being part of the community, having family time, and cooking delicious, healthy food. You can go on my website, and there's a recipe for a wonderful dessert. I made it when I was part of a dinner club that served several members with specific dietary restrictions. For instance, one couldn't have corn, one couldn't have butter, another couldn't eat wheat, another couldn't have milk, and another chose not to eat eggs. And then they asked me to bring dessert. Well, I was getting kind of tired of fruit sorbets and fruit salads, so I made this delicious chocolate cake, and it's called Dr. Maria's Miracle Chocolate Cake, and you can go on my website to get the recipe. You should try it. It's very, very delicious. So today I'm talking about anxiety, depression, and mood disorders in general. Now, it turns out that mood disorders come in a spectrum. The hyper end of it would be anxiety, panic attacks, schizophrenic symptoms, OCD, ADD, ADHD, mania. And then the opposite end would be depression, addiction, having suicidal ideology. And in the middle, where it oscillates back and forth, is bipolar disorder and post-traumatic stress disorder. It's normal for people to feel anxious in certain situations, as well as feeling depressed in others. Our mental status naturally oscillates between feeling good and bad throughout the day as a response to whatever is going on in our environment. For example, a cheerful hello, we can feel good. Work deadline or homework deadline, we might feel anxious. The disease process comes to play when our emotional balance is pushed too far to one end, and then we get stuck there. For instance, depression, or on the other end would be panic attacks. And in certain cases, people bounce back too far the opposite way, and they bounce back and forth between those polar ends. And that's where you see bipolar disorder. Some become very sensitized to stress, and it pushes them quickly to far end of that spectrum, for instance, with PTSD. And thus, with PTSD, it manifests both as depression or anxiety. Some brains become sensitive to stress, and it triggers the neurons to fire off erratically and create schizophrenia or mania type of symptoms. And that leads us to the important topic of stress and the role it plays in mood disorders. Mood disorders usually start with a maladaptation to stress. Stress is a normal part of life, and our bodies are naturally equipped to handle a certain amount of stress. But we see disease manifest when the body can't handle the amount of stress it's experiencing, and then you have maladaptation occurring. That's just a fancy word for not feeling good anymore, as you can see with Cookie Monster. So what causes stress to our bodies? Basically, it's any situation, person, or exposure that disrupts the body's natural homeostasis. Major life changes, chronic pain or illness, environmental pollution of water, air, and food, lack of having daily nutrients needed for basic bodily function is a huge stress. Nobody would attempt to drive a car without putting gasoline in it. So why do we skip meals during the day? That's a huge stressor on our body. And in modern society now, excessive stimulation, whether it be chemical, physical, or emotional, such as noise, bright lights, traffic, caffeine, too much sugar, feeling angry all the time, or worrying all the time. Those are huge stressors to our bodies. Being in negative relationships where there's negative internal thoughts, or being exposed to negative media, those are all stressors on our body. Sleep deprivation, insomnia, not having that important sleep time is very stressful to our body. And finally, chaotic environment, having too much stuff or disorganization or moving around a lot, that is very stressful to our bodies. And what results from our modern day lifestyle? Well, symptoms of poor stress management. This is an important thing to get clear in your head, because what is normal and what is not is becoming very hazy, as so many people are dealing with poor stress management. In our present society, there's a lot of poor stress management going on. That's the number of people on meds for insomnia, depression, anxiety, high blood pressure, ADHD. That's a number of people with weight issues, even though we all know how to eat what we need to eat for nutrition and for weight loss. The average American credit card debt is over $15,000 per person. The number of people who don't get enough exercise because they are wasting hours in front of TV or computer every day, reality check for each patient you work with is a key factor for getting them healthy. Awareness of good, healthy habits. If they are not doing good things for themselves, they cannot feel good. A pill might make you feel good for a while, but then it stops working or you get side effects. A drink might make you feel good for a while, but then there are side effects to that too. So let's look at how to stabilize the body to stress. This is where naturopathic medicine really excels. The basic necessary things for health. Sleep. I always start with sleep. The importance of sleep has been studied quite extensively if you do the research out there. During sleep, your cells are regenerating. There's cellular detoxification and repair going on. In the brain, there's memory processing, synapse connections. Specific hormones are released at nighttime. Sleep retraining is a very simple thing to do. You create a sleep schedule. You help them plan out their bedtime routine. Avoiding media exposure, 30 to 45 minutes bed, is really important because it really affects melatonin levels. And remember, right before the body forms melatonin is serotonin. And before serotonin is 5-HTP. And 5-HTP, of course, comes from tryptophan. So that whole chain reaction is disrupted with a natural light exposure at bedtime. You can support sleep retraining with melatonin and chamomile tea and L-theanine and Epsom salt baths, which is rich in magnesium. Meditative deep breathing has been really well studied to normalize the parasympathetic and the sympathetic nervous system. And yoga. There's a lot of great research done on how yoga is helping with a lot of mood disorders. It also helps with sleep because you feel more relaxed. Next, nutritional planning. Of course, naturopathic medicine excels in nutritional therapy and teaching patients about good nutrition beyond just your basic carb, protein, fat. Eating within 1 to 2 hours of waking is really important. It's like that analogy of the car without gasoline. Blood sugar dropping really affects personality. There's been shown how it affects personality changes and depression, and it can trigger mania and OCD. Certain foods, so food allergies, food intolerances can trigger those same kind of symptoms. My daughter was 3 years old when she had peanuts for the first time, and she exhibits classic ADHD symptoms. She was bouncing off the wall. And as soon as the peanut wore off, she was back to her normal self. And you know, that's when I really saw the effects of food intolerances and food allergies. And of course, we tested that a couple more times because it was so unbelievable, the reaction. Food, really figuring out a person's food intolerance and food reaction is important. Eating real food is important just as well because all the artificial and processing of food items affect the body chemically. So with naturopathic medicine, we have great GI support therapeutics like digestive enzymes and probiotics, complex carbohydrate fibers, and glutamine is a great amino acid for GI health. Betaine HCl, very specific type of digestive enzyme. I also use a lot of liver herbs and gallbladder support. There has been very good research about how specific mineral deficiencies, such as magnesium and amino acid deficiency, is associated with depression. We already talked about gut inflammation being associated with depression. Essential fatty acids have been well documented to assist with mild and moderate depression. And if the fish oil pills are hard for people, I recommend eating smaller fish like sardines or eating walnuts or flax seeds, incorporating that into the diet. And naturopathic medicine offers a lot of great ideas for that. Next would be creating an exercise and activity plan for them. A lot of people who are suffering from mood disorders suffer from being in their head too much. So releasing that by focusing on their body through moderate activity, it really helps get away from their mental focus and into their physical focus, and that gives their mental wellness a break. So the goal would be 30 minutes daily. I work with a lot of really intensive depressed people, and so I create a daily plan for them where we mark out what time they're going to actually do activity, and that kind of gives them more guideline and support of how they're going to spend their time. And pick fun stuff that they like, dancing, climbing stairs, yoga, biking, jogging, just getting out of the house would be really, really key to giving your mental state a break. Next would be relaxation. Now, some good evaluation questions would be, how busy are you on a scale of 1 to 10? If a person's number is too high, being busy is unhealthy. It's stressful. Of course, not, the number being too low is not healthy as well, because then that leads to depression. Another good question is, how rested are you in the morning? That really tells us about how well their sleep is going, and if we need to get more rest time, even that extra 30 minutes, patients have told me, oh, I feel so much better. I have just more energy throughout the day. Another key indicator would be, do you have tight muscles in your neck, shoulders, or back? These are the most common areas for holding stress. Some people don't realize they have stress. They think, oh, this is just life, I'm doing okay. But if they are chronically having tight muscles in those areas, it's most likely that their body is expressing stress. So some ideas for self-care would be stretching, journaling, reading, walking in nature, soft music, breathing exercises, taking a bath or shower. Very simple daily things that you can incorporate into your daily living activities. Make sure that any kind of electronic time is limited. It tends to be too stimulating, even talking on the phone or texting or emailing or anything that's being exposed to the computer can be too stimulating, so limiting that is really important. So we are going to go into naturopathic therapeutics. So I talked about the omega-3 fatty acids and how it's been very well documented to help. The problem, once again, is dosage. 1.5 grams to 6 grams is a huge difference. I shoot for 3 grams a day. And there's been so many different studies with so many different doses that I figure the mid-range would probably be good enough. And you can adjust it according to how a patient feels and how well they are digesting or absorbing it. Someone told me that when they freeze their fish oil, they don't burp it up as much. And so they keep their fish oil capsules in the freezer, and that helps. Some people always have it with food, and that helps. The next item would be chelated trace minerals. Now, chelated trace minerals are great because they're highly absorbable. Trace minerals are so important for cofactors of many enzyme reactions that involve cellular detoxification. And with bipolar and ADHD and even autism, that cellular detoxification is hindered. And so there are a few products that I find that have a really good amount of the trace minerals and well balanced. And that would be Ultra High Multivitamin by Mountain High, and Empower Plus, and Intramax. And you'll have to go online to specifically order these. Another really great nutraceutical is N-acetylcysteine. They've noticed that disturbed glutathione metabolism is associated with bipolar, OCD, and depression. And it's well documented on how it works also great for OCD or kind of addictive personalities as well. So the dose studied would be 2 grams a day, and you can split that out, 1 gram in the morning and 1 gram at night. It takes up to about 8 weeks to really see results. But there was a 2013 study showing on how it helped with gambling addiction. Next would be, I always look for methylation issues, and methylation is a really key process for cellular detoxification as well. And there are some wonderful genetic testings available, and that's why some people respond so well to SAMe, because that is a form of methyl group that some bodies absorb better than others. If a person tests positive for the 5-MTHF gene, I definitely put people on that, and I've noticed a huge difference in how well they respond to their antidepressant if they're on it, and how it helps with anxiety. B-complex and trace minerals are really important cofactors for this whole methylation problem. And then finally, adrenal support. I have almost every single one of my mood disorder patients on adrenal support, and it makes a huge difference on how they feel. Chronic stress and poor stress management, like we covered beforehand, can destabilize the parasympathetic and sympathetic nervous system balance. And thus you see these, the whole spectrum of mood disorders happening. And naturopathic medicine offers such great treatment options. I love these herbs, rhodiola, ginseng, ashwagandha. And then I test for DHEA levels. If their DHEA level is low, supporting that and progesterone, it really makes a huge difference on their therapeutic outcome. And finally, don't forget to use homeopathic remedies. So many times have I listened to a person's story and you think, wow, this person is really dealing with a lot of fear. And, you know, you just add in a fear remedy, 1 or 2 doses, and it really helps all the other therapeutics work so much better. It kind of clears that negative memory that the body holds after a disease-triggering situation. I've used shock remedies. I had a schizophrenic patient who didn't develop any of the schizophrenic symptoms until, you know, he experienced a tragic accident that, you know, caused the death to a friend. And that's when he started having schizophrenic attacks, and he eventually was hospitalized and everything. And listening to that root cause, I gave him a few shock remedies, and I would say he's 95% better now, and he's not on any medication. There's some great mania remedies and delusion remedies, and it's very low risk, and it works where it doesn't, and it doesn't counteract with any of their medications. So I always try homeopathy. I think it's a great tool that naturopathic doctors have. So now we'll do a case study, and I chose this specific person because we got such great results. It was a 34-year-old male who came in with suicidal depression and alcoholism, and he had been hospitalized the year he came in twice, and he had been put into 2 treatment programs for alcohol addiction, and had been put on several antidepressants since college, and yet he was still having depression and addiction. And so, of course, he tested positive for the 5-MTHF gene, and so along with that, you have to always, you know, provide a trace mineral complex. And just the stress of being hospitalized and dealing with addiction and depression, I put him on some adrenal support formula along with the B vitamins. And by the 3rd day, he reported being able to get out of bed, like on his own. And by 1 week, he reported having more energy that lasted throughout the day. And after 1 month, he was feeling so good, he discussed with his MD to start reducing one of his antidepressants. And he was also experiencing constipation from it. And at 2 months, he was 50% off of all his meds, and he was starting new projects at home and started going to AA meetings, and he reports being sober. And it's probably been about 8 months now. He still struggles with some social anxiety, and part of that is, his pattern. But he says that the adrenal support has helped immensely with that. And he takes a rhodiola, 2 dropperfuls, morning and noon, to follow the kind of natural rhythm that our body's cortisol is released. And so my tips for practice success would be, number 1, good patient care. When a patient feels that you really care for them and that you want to understand their situation, there's that whole trust-building relationship that happens. And as a doctor, you clarify what their health goals will be, and that helps them focus on what they need to do to reach that goal. And of course, I always create a plan. I put them, I have this weekly schedule, blank schedule out that they fill in, like what time they're going to get up, what time they plan to go to bed, what time they're going to do activities. And that gives them structure, it gives them accountability, and also support. Mental wellness patients need regular follow-ups, lots of support. I would recommend weekly follow-ups for the first 2 months until they really stabilize at least 50 to 70%. Second thing would be good communication, choosing words wisely that are empathetic and compassionate. And you meet the patient where they are. These are really broken people, and we gently guide them toward their health goal and be very clear and realistic about progress. Some people feel like they want a quick fix. All healing process is not linear. There are ups and downs. It kind of goes up and down, but their bad days won't be as bad, and it won't be as long as it used to be. And they're going to move toward health, but it takes time. And, I always remind them, you're still going to have good days and bad days. You just hang in there through the bad days, and the good days will get bigger and better. And having good intention. Really believe and trust in the healing power of the body. So many times I want to add an extra vitamin or add an extra herb, and I think, okay, let's just give it a little more time and see how the body recovers. And the body is such an amazing, amazing system. And if you focus on getting the patient better and not proving, how well your medicine works, then that good intention of just getting the patient better in itself is great medicine. So looking forward, my future plan is that naturopathic medicine be accessible to everyone as a healthcare option. I really look forward to the day where, people can buy health insurance and find a naturopathic doctor. But in the meantime, I try to make it affordable and practical for all my patients. So my final message would be, do good to feel good. And thank you very much for listening to my presentation, and I hope you learned something practical and useful. And I would love to answer any questions at this time. The moderator will forward it to me, and I'll wait for any questions.
All right. Thank you very much, Dr. Cartwright. Okay. I just have one quick thing I want to go over with everybody. You are all invited to attend our next webinar that we have in February. Dr. Steven Sandberg-Lewis will be presenting on gastroesophageal reflux, underlying causes and relations, and that's on February 19th, and you can go ahead and register on our website. I will now open the floor to any questions that you guys may have, and we will start with the first one right now. Okay. What specifically is L-theanine helpful for, and why specifically does it help with sleep?
L-theanine is not specifically for sleep. It's more of a relaxant. It's an amino acid, and once again, like tryptophan, it goes through this process that the body takes it through. I find that just melatonin, the end product, is more effective and quicker than using any of the amino acids, because some people ask me, oh, should I use 5-HTP or tryptophan or L-theanine? And I add in L-theanine for people who kind of have this generalized anxiety disorder and they just need to calm and feel relaxed overall. But I find that melatonin is far more effective.
Okay, thank you. What is your view of taking amino acids in supplement form to assist with anxiety and depression? What if you are already currently taking medications?
Right. If you're already currently taking medication, amino acids as a whole should be fine. Remember, there's 20 basic amino acids that the body uses, and it's provided in nature. I would have to say that there is amino acid level testing available, and if you are specifically low in certain amino acids, it would be a good treatment option. I've known ADHD patients who have done that, and they feel much better on it. Overall, though, holistically speaking, being on all the amino acids is really important, and I do that through a protein shake that I recommend. Yeah, I think that answers the question. But amino acids are important, obviously, because it's essential to, your basic body function.
Okay, thank you. The next question is ground flaxseed still good for omega-3 fatty acid absorption?
That's a good question. The amount of absorption per person really varies depending on that body's unique makeup. Everyone has different levels of digestive enzymes and pancreatic enzymes and even liver enzymes. I think that variety is key. I rotate through walnuts and flax seeds and fish and salmon and even the different kinds of fish, and then fish oil caps. Alternating that really ensures optimal absorbability. So, and listening to your body. Some people will say, oh, I've been on, ground flax seeds and I don't really notice a difference. And then some people will say, wow, even being on fish oil for 2 weeks, I really noticed a difference in my skin and in my mood. So listening to the body is very key.
Okay, thank you. Do you utilize micronutrient testing to identify vitamin deficiencies in your patients suffering from depression?
What I always start with is those, basic naturopathic health things like sleep and nutrition and exercise, all that first. And I honestly find that just getting that stabilized, it helps their depression 50%. And then from there, I really fine-tune my therapeutics to, is there a biological insufficiency where they do need specific amino acids or micronutrients? And at that point, I discuss with the patient if they would like to do that. And if they're already feeling 90% better, most people will say, no, I'm okay with what I do. But if they're not quite up to where they want to be, we will explore more and do those tests. And, it's about half and half. Sometimes we find things and sometimes we don't. A lot of times it's situational. There's, cognitive behavioral stuff going on that's affecting their mood. And so I just try to listen to what the patient wants to do, and then I honor that.
Okay. If I wanted to take just 3 supplements to better my anxiety, what 3 would you suggest?
That's a really good question. Well, sleep is a huge part of anxiety. So if you're not sleeping well, I would do things to help with sleep. Adrenal support would be the second thing I would recommend. And then if you have a family history of anxiety, I would really look into the 5-MPHF. and get that genetic testing done. And if that is an issue, it makes a huge difference on your anxiety level. I have a daughter who was just born anxious, and it turns out, she has homozygous for that gene. And her anxiety level is always so high. And, we do rescue remedy and different herbs and chamomile tea, but it wasn't until she actually got on the 5-MTHF that I would say I noticed 90% difference in her anxiety level and her mental well-being and attitude. She used to be such a dark, negative kid, and now she's just this bright little beam of sunshine. And so I would say that the 5-MTHF would be key for anxiety.
Is there a recommended brand for the 5-MTHF?
For genetic testing?
I believe so, yes.
Oh, okay, sorry. Of course you can't find it. Okay. There are several companies out there. SpectraCell is one of them. You go online and there's more and more companies or labs are offering. Doctors Data offers it now. It really depends. There's a wide option. Many of my patients have insurance, and so SpectraCell really honors insurance and makes it really easy for them. So that's what I have chosen. But there are many companies out there offering it. You just go online.
Okay, thank you. What are good sources, pardon me if I say these words wrong, what are good sources of rhodiola, betaine HCl, and glutamine?
Okay. I like to order through Emerson Ecologics because they have a program where they look at different companies and they independently test what's supposed to be in there, and they list all the ingredients, and they have gold standards and silver standards, and from there I look at dosages, and I find that for herbs, the liquid extract works the fastest. It's highly absorbable. People who cannot do alcohol should not do liquid extracts. I like Vitanica as an herbal company. And for L-glutamate or glutathione, there's liquid forms and capsules. Any of the companies that Emerson Ecologics has their stamp of gold standard and silver standard, I can trust. A lot of my patients are very allergic, and so I look for products that are corn-free, dairy-free, soy-free, wheat-free, egg-free, and you just have to really kind of weed through it. There is not one company that does it all great. And so if you go to my website, you can actually look at my dispensary, and you can see which forms that you would like. And I do extensive research on finding hypoallergenic formulas.
Okay, thank you. What is the protein shake that you recommend?
I like it's from Innate, and they have really, really hypoallergenic pea protein protein powders, because the soy protein powders and the whey protein powders are on the allergen list. So that's what I like to use. But some of my patients, find in the marketplace, they like the Be Alive live protein shake. It's all personal preference because the flavor will vary, and you need to try it out before, you find if it's compatible to your taste buds or not. But I do like Innate's protein powder.
Okay, thank you. I know there are many forms of magnesium. Is one form better than another?
Chelated forms of minerals are the best absorbable. People respond very differently to magnesium depending on their body types once again. And so if I find that, sometimes a powdered form of magnesium calcium can cause bowel problems. And then I do the chelated form. Chelated form is always more expensive. So once again, cost is a factor. You can start basic and see if they tolerate it. And if not, spend a little more money and get the chelated form.
Okay, thank you. What testing would you recommend for those diagnosed by allergies with multiple food allergies or severe gluten sensitivities who struggle with depression, anxiety disorders?
Can you ask that one more time?
What testing would you recommend for those that have allergies and multiple food allergies?
Mm-hmm. Yeah.
I
have not, right, suffer from depression and anxiety.
Yep.
So once again, I would start with the methylation. I find that people who, are very reactive have a methylation problem. That's why they develop food allergies. Blood test-wise, I see such varying results that I really do the gold standard food elimination and testing. For instance, my daughter's allergic to green beans. It's such a strange thing, but you never know what a person's reactive to. So I have them do food diaries and really look at what they eat and how they feel afterwards. And it takes time and it takes dedication, but that really is the gold standard.
Okay, thank you. Do you have any strategies for patients to use at the time when they are experiencing a trigger that causes them to stress in their life?
There are really great studies about unilateral nasal breathing technique. And you can look it up online. It's a type of yoga breathing, but just doing that exercise helps balance out the parasympathetic and the sympathetic nervous system immediately. A lot of our patients, I require them to do yoga at least once a week, and they learn some of these techniques. And I have autistic kids who, when they're stressed out, they go into a yoga position, do their breathing, and they feel better within minutes. Another great thing to have on hand, and people who don't drink too much coffee or smoke, they respond quite well to the rescue remedy, Bach flower rescue remedy. It's inexpensive. You can carry it around, and it works like a charm. I have people do that and have really good results from that.
Okay, thank you. Is it recommended that only a licensed practitioner like yourself to administer the adrenal support system and other naturopathic therapeutics, or can you possibly find those treatments at a local store yourself?
Well, adrenal support, that's a good question. There are some really good formulas out there for adrenal support now. I mean, I walked into Whole Foods and was quite impressed. Like I said, the liquid herbal extract, either eleutherococcus or rhodiola or ashwagandha, I mean, just even starting on that, just people feel better. The trick is that sometimes people will use the adrenal support like they do with caffeine. They use it for their adrenaline high, and they never really get it balanced out. And so that can cause, more adrenal function. The reason you would see a professional is really to get that support and that well-rounded therapeutic treatment plan. And having an outsider kind of guide you and give you feedback on how you're doing is really important in getting a clear sense of, how well you're doing. I know that I think I'm doing okay, and I've suffered with I will be suffering with a, kind of like a backache, and I'm thinking, I'm okay because I'm exercising, I'm taking my adrenal support, and I'm doing all this stuff. And then finally, my doctor friend will be like, you're really struggling right now. I think you need a little more support. And having that feedback, I think, is that, that patient-doctor relationship that helps in getting better sometimes.
Okay, thank you. As each accredited naturopathic college has different strengths, what do you think is the best plan to become an ND focusing on mental health?
I would look at clinical opportunities. So at Bastyr, when I was going there, Dr. Ellen Gaby was there, and so I got a lot of, thyroid and hormone and adrenal kind of nutritional therapeutic experience. I know that at Portland, Dr. Dick Tom was there, and, he did a lot of kind of biotherapeutic drainage. And so I guess you would look at instructors and clinical opportunities to see where your interest lies. And once again, another reason I picked Bastyr was because they were doing research, and coming from a UC background, research was important to me to really know, what these natural therapies are doing and how it works. And that was my concern. So I think part of it is personal preference of what kind of clinical opportunities, research that, and I think you'll pick the right school for yourself.
Okay, thank you. What are your best suggestions for veterans with PTSD?
Adrenal support, absolutely. Homeopathy, I think, is great for PTSD. Yoga once again, because that helps with self-regulation. A lot of times veterans, are in that survival instinct mode, and they don't know how to, break away from that because they've been in that situation for so long, or life and death situations, which is really not a normal, stressor that the body has to go through. And so, to repeat, I do homeopathy, definitely, yoga, and adrenal support.
Okay, thank you. What is the best approach to begin treatment for ADHD in kids and teenagers?
Kids and teenagers, number one is food. Blood sugar dropping. Kids and teenagers are teenagers especially, they hate eating breakfast, and then when they do eat something, it's high sugar, and then, their blood sugar drops, and then they spike it up, and then they wonder why they have, attention problems and hyperactivity problems. Food additives, sweetener, the fake sweeteners, all that stuff. And cleaning up a kid's diet is so difficult because there's so much processed foods out there, and it really takes dedication on the parents. And that's where the protein shake, is really easy and simple. That, I think, is really important. And from there, you look at, once again, the trace minerals, putting them on just a really good multivitamin, especially because the nutritional status is most likely very poor in kids and teenagers. Being on just a good multivitamin. And I use a lot of Intramax, which is a liquid multivitamin, and it has the omega fatty acids already in it. I think that's a great tool for kids and teens. It's easy. You just take 1 tablespoon twice a day.
Okay, thank you. What are your thoughts on the Bash flower essence?
It's just like any other medicinal modality. Like, some people really respond well to it, and other people it doesn't do much. I don't respond very well to homeopathy, but I respond very well to Bach flower remedies and to herbs. I think herbs I respond the best to. So that's what's great about naturopathic medicine, is that we have all these great modalities that we can really personalize and cater to a person's unique physical makeup.
Okay. How do you feel about the relationship between traditional medicine and naturopathic methods?
Well, I think in conventional medicine, they are seeing more and more, how certain nutritional deficiencies are affecting health. So nowadays, almost everyone tests for vitamin D levels, which, naturopathically, we've been looking at that way before conventional medicine has. It's slowly getting incorporated. I think it's important that that's one of the reasons I do look at research and what's out there with, like how some people respond to SAMe and what it's being used for. And, now we know it's part of the methylation issue. And so I really feel like the medical world is becoming more well-rounded. Of course, there's a long way to go. And but as naturopathic doctors, part of our philosophy of care is, being a teacher, doctor as teacher. And that's not just to patients, but to other doctors as well.
Okay, thank you. Has there ever been a time where natural medicine has not been successful that you've dealt with?
Yes, people who want a quick fix. Even adrenal herbs, you're going to feel better, but if you don't change all the other underlying root causes and you think that your adrenal herb is just going to take care of everything, it's not going to work. That's not how, health works. And so I spend time kind of educating and bringing to awareness that these are just support. You don't want to, if you hurt your foot, you don't want to wear crutches for the rest of your life. You just use crutches until you heal, but then you don't re-injure your foot. Otherwise, you're never going to really get back to walking normal again. And so it's a matter of education, I believe.
Where do you hope the field of natural medicine will go?
My vision for it is that that every person gets an opportunity, if they choose to go to be able to see a naturopathic doctor as part of, their health plan. And the same thing, like if I want to go to an acupuncturist or a chiropractor, I hope that one day we can just see any practitioner that we want and that it's accessible through our health care coverage.
Okay. Do you typically have your patients take a genetic test? Is it typically revealing for mood disorders?
Yes, if there's a family history of suicide, depression, anxiety, and you'll hear it. I've had the case study I had. I mean, one of the reasons we even started with the MTHF testing was his uncle had committed suicide. His sister, was on antidepressants. The grandmother, had depression. So if there's a huge family history, it's most likely that there is some sort of genetic deficiency going on.
Okay, thank you. This will be our last question. Do you consider an individual thyroid health when treating someone with a mood disorder?
I look at thyroid on everyone. Thyroid is so key for, just basic cellular function. So I look at thyroid, I look at adrenals, I look at digestion, food reactions. Those are all just the basic naturopathic approach to looking at disease.
Okay, and Dr. Cartwright, we've had several questions for people asking to see your website and information again. So I'm going to have you quick pull that up on your screen if you don't mind. I will change you back to the presenter. Yep, there you go. Okay, so you guys should all have her name and her website if you would like to check it out. And we are out of time now, so on behalf of AANMC, I would like to thank Dr. Cartwright for her time. I'd also like to thank all of you for attending this presentation. The webinar has been recorded and will be available on our website, AANMC.org, in about a week or so. So thank you all for attending and have a great afternoon.